Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. Good to see you.
Good to see you. We've just been talking that we're in withdrawals.
What's wrong with that? Sorry.
Gosh.
Yeah, everybody.
See, this is what's happening.
Right.
Because we're not meeting Tuesdays and Wednesdays, so the cameras are all out of whack.
The cameras are out of whack.
I don't know what I'm doing. You don't know what you're doing.
We spend 20 minutes catching up on our lives.
That's
and then
what
we start
happens.
a show.
Yeah.
I know.
Yeah.
But anyway.
How's it been going since the last time I saw you?
That's right. That's
and then
right.
We're we have a show.
But here we are.
Okay.
It's good to see everybody. Good to see you. Good to see everyone.
Yeah. Hey, everyone.
It is Thursday, July 9th.
Yeah.
Here we are.
Every time you say the date, I'm like, have you noticed that? I sigh deeply.
I know.
I mean, it's a good thing that time continues on for me.
Right.
I mean,
it's fluid.
It is
yes,
fluid.
it is. It is. Sometimes the fluid runs faster, and sometimes it's like molasses, you know?
There you go.
Yes.
That's good.
Yeah.
And they get sticky in it.
Right.
And I'm sticky in time these days.
I think time is a little sticky for many of us this year. 2020 is a sticky year.
It's a sticky year.
I think that is very profound.
I think we're now, let's see, we're almost in 6 months fully. Yeah. I think at the end of this month, isn't it? At the end of August, I guess, since it came to America.
Well, right, January, I would say. I think March is kind of the time when we all kind of lock down. That's when
it's the spring break we never returned from.
That's right.
That's
kind of my time.
Yeah.
Stamp,
certainly
if you will.
Nearing 200 days. Yep.
Exactly. Anyway, we're glad everyone's here. We have some great guests lined up, and we're going to talk to one of them in just a second.
Yeah.
Because we're ready to go. And so our first guest, I believe, is
on the line.
On the phone. So let's see who it is. It's like mystery phone. Good morning. You're on KSJE.
Hi. This is Dr. Soma Grodefend. I was
yes.
Number for an interview.
Yes, Dr. Grodefend, we've got you on the air. Thank you for calling in, and we appreciate you being with us. You are a doctor at San Juan Health Partners Urgent Care, correct?
Yes, I am.
Very good. Well, talk to us a little bit about caring for patients who are coming to urgent care. Obviously, people are still getting sick, things are still happening, and so folks still need to be able to come and see doctors like you, even with a pandemic going on. So maybe you can talk a little bit about some of the things that that you're doing there at urgent care.
Certainly. Well, it's full-blown summer, so everybody's getting hurt and sick, which we hope that they wouldn't, but there's more injuries as they usually are in the summer. And I guess what I would want to say is one of the safest places you could possibly come to in a pandemic would be a prepared urgent care or an emergency room, because we actually know how to protect you and ourselves from getting sick. So we're definitely open and taking care of things, as well as helping to test people who are symptomatic for the COVID virus and seeing what kind of support we can put into play for them.
So you did mention testing just now, and I think we've had repeated questions on who should actually get tested, and sort of the questions are trying to get a little more nuanced. So we know that New Mexico has more tests, and it's kind of in the refrain where it's like, well, anybody wants to get tested. But do you have specific suggestions on who are the populations that really need to get tested?
Well, and that's an excellent question. The New Mexico Department of Health has regular testing on certain dates at certain times, and you can get on to the New Mexico Department of Health and look up Farmington for specifics on our area. When you come to urgent care or the emergency room, we are using slightly different tests that are still in somewhat short supply, so we are limited by testing criteria. So we tend to test people that fall into that criteria, which would be if you're having symptoms of COVID, which would be a cough, a fever, definitely any loss of sense of smell or taste, and body aches, those kinds of things tend to be part of COVID, and whoever is running the part of the urgent care or the emergency room that's testing for that knows the criteria. So those are people that get tested at urgent care. If you just want to be tested, the New Mexico Department of Health sites are by far the best, because they're testing anybody who comes. They need to actually have you sign up in advance to keep it a little more orderly, and that way people don't waste their time standing in lines. But there are all kinds of options for testing now.
Great, thank you. And also, we have some questions on the development of lasting symptoms. So you mentioned like taste and smell and that kind of stuff, when those things return. There's been some stuff about lasting neurological defects. Do you have any information on that?
Yes, the consequences of getting through the actual virus itself are starting to become more and more evident. Losing the sense of taste and smell is something that's very unique to COVID. So I would encourage anybody who has suddenly lost their ability to taste or smell, that's concerning. It does seem to come back after about a month to 2 months. Some people it comes back sooner than that, but other people it takes a little bit longer. It does seem to come back, however, which is good news.
Right. And doctor, we're seeing certainly a lot of increase, it seems, in cases and numbers. The state's certainly concerned. Our neighboring states are seeing increases as well. And so what are you hearing from your colleagues about whether we're getting a handle on this? Are you concerned about another surge possibly coming to overwhelm our hospitals and healthcare providers? Or what do you think? Is New Mexico still in good shape to get a handle on this?
Well, New Mexico has done, I consider, a pretty fantastic job, but I've heard, we're the front line, the doctors and nurses and that sort of thing, but in reality, the general public, we're the front line, and we can really help. There are very simple steps. There's really no debate about wearing a face covering, a cloth mask, in helping to decrease the possibility of giving someone else the illness when you don't know you have it, because COVID does have a 2-day time period before you have any symptoms where you can actually give it to someone else. So properly wearing a face mask, which means it's covering your nose and your mouth, it's not hanging off of your ear or it's not hanging underneath your nose, is extraordinarily helpful and beneficial in decreasing the spread. And then the second part is just washing our hands, which we've advocated as healthcare providers. I've been a doctor for 30 years. First thing I do when I get home is wash my hands. That's a very simple step, and it's extraordinarily effective in protecting ourselves and others from getting this. So there's still very much hope in our ability as individuals to do the right thing and to help prevent spread of this virus to people we care about and also to strangers as well.
Yeah, I think that's always an important reminder for our listeners and viewers to hear. So say I go into urgent care, I test positive, or I test positive at the Department of Health test, and I guess usually it's go home and quarantine. But at what point, if I'm home quarantined and I have COVID, at what point do you suggest, now it's time to actually go to the hospital emergency room?
And that's an excellent question as well. What I have educated everybody I talk to in our COVID area and anyone who listens is a really important thing, and I like to give an example, is someone who's truly short of breath cannot complete a full sentence without taking a breath. So it's pretty obvious, and what's so interesting is when people become symptomatic like that and they're not getting enough oxygen to their brain, we don't tend to be very nice or make good decisions. So people tend to be a little combative and say, I'm just fine, everything's just great, I don't need any help. When you hear someone you love or yourself talking where you cannot complete a full sentence without a breath, that is definitely time to go in and be seen. Also, if you're really unable to meet your own needs of, feeding yourself, that sort of thing, obviously those are times to get in. But the important thing is when you're symptomatic without it that bad, you've got to be drinking plenty of water.
Very good. And we had a question on Facebook, Doctor, that I wanted to pass along and see your thoughts on, is how often should essential workers be tested where COVID-19 may be everywhere? Because we know that a test just tells you how you are at the point of that test. Right.
The unfortunate part of what's happening with testing is a negative test doesn't mean you don't have COVID. There's a thing called false negative, meaning you actually have it and the test says you're negative. So what's extremely important is there's not necessarily a timeline of which people should be tested. I know a lot of places are testing weekly, that sort of thing. If you're having any symptoms, it is extremely important to get tested. And then if you're still having symptoms but you get a negative test result, you shouldn't be around other people because that test can be falsely reassuring. A positive test does mean you have it. The nasal swab, if you have a positive, you definitely have COVID. But a negative test doesn't necessarily mean you're safe, so paying attention to symptoms is critically important.
That makes sense. And we have one more follow-up on testing. There's been some talk about testing pools these days, testing like 5 and running that through, and then if it comes out negative, we assume people are negative. Is that something that is happening, or is this like a, sort of cutting edge on information?
Right. That would certainly be an ideal, is to have repeat negative tests, because the probability goes up that it's correct if you have multiple results of the same thing. But I'm not aware that we have an overwhelming supply of tests in order to do that at this point in New Mexico. That would certainly be a good thing. I'm just not aware of that actually happening yet.
Gotcha. Very good. And so, Doctor, when we talk about urgent care, again, you and your colleagues are still there for the usual, as you mentioned, it's summertime. So if stuff happens this summer, people can still certainly come and get the care they need at urgent care or even at the emergency department, but still know that you're there working, you and your colleagues?
Absolutely, and know that you're not going to catch COVID from coming to urgent care or the emergency room. So definitely don't let that fear stop you. You're way more likely to run into problems in stores and things like that as far as actually getting COVID. So please don't let fear of catching the virus prevent you from getting health care services.
Very true. Well, Dr. Grotenfeld, we appreciate you calling in this morning, and thank you for the work that you and your colleagues are doing to keep us all safe. Thank you so much.
Certainly appreciate the time to get to share good information. Thank you.
And good information it is. Thanks again. That is Dr. Soma Grotenfeld from San Juan Health Partners Urgent Care.
Urgent Care,
with
yes.
us this morning. And she mentioned testing, and I just want to pass along the Department of Health. There was testing here at San Juan College this morning, and I think there'll be similar testing next week. We'll share that on Monday's show. But they continue to do testing, I know, here at the college and at the Judy Nelson School in Kirtland.
Yes.
2 days a week.
Yes.
So there's that. But since it already started, I'm not going to show the graphic because
Right.
it started.
And of course, as
Already.
the doc was saying, testing is a snapshot, so once negative does not mean always negative.
No,
And-
that's true. So we should still do what we're told to do and,
Yes.
and been advised to do.
Please do
The
what
washing
you're
of
told
your
to do.
hands,
Yes.
don't touch your face, wear a mask when you're out and can't be 6 feet away from people. I mean,
Well,
that's
even
just,
when you can be 6 feet away from people. Just
Right.
when you're out, wear a mask. When
That's
in
what-
doubt,
there you
wear a
are.
mask.
Okay.
Yeah.
But-
So,
But yeah, I believe the governor's going to give an update this afternoon, by the way, on some of the numbers and how we're doing as a state.
cool.
So there's that. But you have numbers.
I do have
right?
numbers,
And
yes.
we can talk a little bit about those numbers
Yes.
and show them, because I think we're prepared this week to show the Johns Hopkins
Right.
numbers.
So every time we do a show, I share the Johns Hopkins dashboard numbers. And what's also very helpful about this website is it gives you some really cool looking graphs and somewhat startling if you for our radio listeners, you can't see it obviously, but looking at this map, the United States is all red, and so we're red, and South America, or it looks like, or not South America, but middle Mexico and
Central America?
Yes,
Is
yeah,
that the-
Mexico
Okay.
and Central America.
Certainly
I'm sorry.
the coastal areas of South America are red.
Yes, that too.
And Europe is red.
Right. So it's just a very fascinating map to check out, but certainly the United States is on fire, it looks like.
Right.
And speaking of which, as of last night, Wednesday night, 3,054,650 cases of COVID-19 have been reported, which is an increase of 60,891 from yesterday, big number, and 132,298 deaths have been attributed to the virus, which is an increase of 834 from yesterday. The mortality rate is holding steady in the data at about 4.3%. Of the 37,431,666 coronavirus tests conducted in the United States, 8.2% have come back positive.
Aha.
So, lots of numbers I know, which is why there's this helpful visual online.
Right. I'm just loading the U.S. map
specifically. Oh,
right
great.
now from the global map.
Right.
So we can kind of see.
So
What we're
so
looking
our
at.
state, or New Mexico, is purple, most of the state.
Actually, that's Arizona's mostly purple.
Okay.
But we're our corner's purple, but
Okay.
but we don't have as much purple as some other places. But look at the deep south. I think that's another
yeah.
concern, like Florida, Georgia, Alabama, the Carolinas. I mean, that's a concern. Arizona's purple. Southern California is purple. As we're seeing it on this graph, there's some purple spots in the Midwest, and around the Chicago area. So, anyways.
Yeah, so helpful stuff to look at if you're really interested. And I think we're discussing getting hopefully an economist on the show next week to help us wade through some of these numbers, because as we know, at a certain point our brain just taps out when it comes to numbers, and it's hard to really conceive of what's going on. And a couple of months ago, the New York Times did produce that Sunday edition that had just a list of names, just pages of names. And if you think about that, at that point, the number compared to today, we've increased so much. And so, I mean, just putting it into that kind of sobering sort of paradigm of sorts, like these are lives, whole lives with relationships and all sorts of things. And so I'm looking forward to getting somebody on that can explain some numbers, including what our economic state is. So
I agree. Well, we'll work on that for Monday.
Yes.
Or next week sometime. So
Yes.
very good. We're going to have another caller.
Cool. Great.
So let's go back to the phones. And good morning. You're on KSJE this morning. Thanks for calling in.
Hi, this is Stacy Beal.
Hey, Stacy Beal. We're glad to finally connect with you. Thank you for calling. You're a busy lady.
Thanks for having me.
You're a busy lady, and of course, Stacy has been working with this Facebook group, Masks for the Four Corners, and so I don't even know if you've been keeping track, Stacy Beal, about how many masks your group has been making for entities around the region. But how's it going?
It's going well. We've made over 10,000. We've provided over 10,000 masks for folks in the Four Corners, which we were very happy to do. We have wonderful volunteers that help, and it's going gangbusters.
Yeah, it certainly is so impressive. I know that anytime I've asked for masks, your group is fast. I mean, I can't even sew a button back on to like a jacket or anything. So I'm just, I know. Maybe I need to get a physically distanced lesson on just button sewing, and then maybe we can level up to masks.
There's got to be a YouTube video for you somewhere, but we'll find you one.
Oh my
Okay.
gosh. Anyway, so as schools, we have no idea what schools are going to do in the fall just yet, but certainly we've heard a lot about excuse me, if schools come back in the fall, if students come back in person, that masks are probably going to be a requirement. And so is that something your group is prepared to act on?
Well, we're preparing. That's what we've geared up for about a month ago, is really because I've talked to some folks from the various, schools, and
We may have lost Stacy. Did you mute? Are you muted? You're still connected to us, but we don't hear you anymore. Well,
Everybody has that corner of their house where they get better reception.
Maybe
so
that's
maybe
it.
she's
Yeah.
running there now.
that could be. Stacy, you're still with us, I think, but we've lost you. I'll put you back on hold and can bring you back. Anything? Nothing.
Oh man.
Live radio.
I know.
Live radio.
This is like these are the nightmares I have. It's like that old recurring dream where you show up for a test totally unprepared.
Right.
Do you ever have those?
Sure.
Wait, here we go.
Good morning. You're on KSJE. Stacy, are you back?
I'm back.
All
Okay.
right, cool.
Thank you for calling back in.
Technology at its greatest.
That's right. That's
right.
right. Anyway, you were talking a little bit about some of the schools and what your group is doing for schools this fall.
Right. So we're really gearing up. We started about a month ago really pushing the Match for Children. So, we're just working as hard as we can. It would be terrific if there were some folks out there that knew how to sew and could help us with the sewing. I've got quite a bit of kits made up that consist of the cut fabric and the elastic for the pleated mask. And so if we had some seamstresses out there that could help us put those together, it would be fabulous.
That's terrific, and I'm sure you'll hear from a lot of them. And the best way for them to reach out to you, Stacy Beal, is through that Facebook group, or is there a better way?
Yes. The Facebook group is called Making Masks in the Four Corners.
Okay.
So if someone just wants to get on there and offer to help, that would be terrific.
Very good. And I know you've also been accepting donations of mask-making materials. I think anything from fabric to elastic to buttons, I think, has been dropped off at your doorstep over the last few weeks.
Months.
Yeah, months. Yes, and we've gotten even, you wouldn't imagine some of the donations we've gotten for, pipe cleaners to make the nose bridges. And it's been interesting to see how creative some of our members are and what they can do to make the mask situation work, especially since at the beginning there were such shortages of fabric and elastic and that type of thing. So it's been a fun little experience.
Right. And for the group members, I mean, how many would you say you have actively working to help in this regard? Are they? I mean, your small army is still creating masks, aren't they? I mean, the demand is still there.
They are. It's slowed down a little bit. I think people are kind of getting a little tired, and so we haven't pushed ourselves as much, as far as me trying to push people to do it, because I think they kind of need a little bit of a break. But now we're gearing up, and we need to get these masks made for the kids. So, we'd especially like to reach out to folks that aren't on the internet, that don't have a Facebook page, that maybe don't know about our group, and that would be especially like church groups and organizations. Maybe even your book group would be interested in maybe helping create some masks for us. Quilting groups, that type of thing.
Great. And I have a question specifically about kids' masks. It seems like there's been like a one-size-fits-all thing, but if I'm making masks and I want to focus specifically on children, is there like a suggested, I don't know, diameter or like size of mask?
I'm sure there'd be a smaller pattern, right, for a child's mask?
Yeah, there is. And we're trying to go with with our pleated mask with about 3 different sizes. It's so difficult because, it's not one size fits all. And even with the adult masks, we'll have people complain, oh, these are huge. And then I'll have the exact same mask, type, the same size, and try it on, and it won't even touch my ears. So, people come in all different sizes and situations, so it is hard to find the right size.
Sure.
So I've worried about that dilemma, how the schools will handle that, because it really is difficult. I would always err on the size of too large, because you can always, put a knot in if your masks have elastic, put a knot in it or something like that to where it tightens it up. Much easier than trying to make it bigger.
Good point. Very good point. Well, it sounds like you are in pretty good shape for the demands that we'll be needing. Of course, when we think about how many students we have going to school here in the Four Corners and in San Juan County, at least, we're talking a lot. I'm trying to add up how many students we have. What do we got?
Well, in Farmington alone, there's over 10,000.
That's what I was thinking. Yeah, 10,000 in Farmington schools and maybe about 3 in the other districts, perhaps, but it's a lot. So
it's a lot.
Yes,
it is a lot, and a lot of those kids. We're not expecting to be responsible for every child, getting a mask. But there are a lot of families out there that can't afford to buy masks, and, we don't want to put any type of a child in a situation to where they don't have one and they need one, to embarrass them. And so that's why we want to make sure that we have plenty for them that we can hand out, and we want to keep our kids safe in the fall once school does start. And, it's a sad situation out. Whoever thought that we would all be wearing masks? So
Exactly.
but
Well,
it's something we have to do.
right.
So we're going to try to do what we can to be prepared. So like I said, what we're really lacking right now is people that can sew. And so if somebody knows somebody out there, their mom or somebody, an aunt,
Right.
cousin, please look us up, and they can always contact me on my cell number too, and that number is 486-1401. And so if they're not on Facebook, smart person that isn't on Facebook,
Right.
that's the number to call, 486-1401.
Okay. Very good. Well, and we appreciate that, Stacy, and all the work that you and your volunteers are doing. Again, as you mentioned, you've made over 10,000 masks already, and still going strong. And I can understand needing a little bit of a break, but ramping it back up for school, I think, is now's the time to start up again. So there you go.
Then explain that we haven't really. It's just we haven't intentionally slowed it down. It's just that I think people were kind of over the mask thing a little bit. And so now they're ready to get started and go back to work doing it. I think with the 4th of the July holidays and that type of thing. So we're ready to go. So we need some more volunteers to help us. If they're out there, please let us know.
There you go. Well, we appreciate that. And again, we are airing this on KSJE Radio and also our partners over at KNMI Radio. So if we have some radio listeners who aren't social media people, they'll be hearing this message too, which is great. And you'll be getting hopefully a lot of calls.
Well, thank you. I appreciate that.
You bet.
We'll see what we can do to help.
That's true. Very good. Well, Stacy Beal, thank you, and thank your volunteers for the work that you continue to do to keep us all safe, and again, to help the kids going back to school. And like you said, who knew we'd be wearing masks, but it seems like we might be wearing masks for quite a few months to come. We'll see how it goes.
Yes, that's true. You guys, thank you for listening.
You bet.
I appreciate y'all.
Thank you.
Thank you.
Thank you, Stacy.
Bye-bye.
Thanks for calling in. That is Stacy Beal. Making Masks for the Four Corners is the Facebook group. And again, if you know people that can sew, that sounds like that's their biggest need right now. They've got lots of donations of supplies and fabric and elastic and pipe cleaner wire for your nose and whatever else you need.
We just need the makers.
Right.
Yeah.
So.
Yeah. Stacy Beal, she's like the Clara Barton of this disaster.
Right. Right.
It's amazing.
That's true.
Yeah.
So there you go. But great to see the community coming together like we've always
That's right.
have done in some of these things. So there you go. We wanted to show some other numbers before we go today, but we appreciate everybody calling in again. And let me turn and do that right now.
Right. So
what else is going on?
Yeah. So while you do that,
wait, I think I have.
Wait, is it pulled up?
Well, I might have them here. Let's see.
Because we could always spare the audience from another interesting
seeing
fact.
the side of my face.
No. Sure.
I thought that's where you were
going.
going.
No, I was going self-deprecating, but I much prefer deprecating you.
Right. Oh, I know. Join the club. Anywho, here we are, everybody. The latest numbers from our state yesterday. I think a large increase in daily cases, 290. I think that's one of the higher numbers I've seen. And I think I saw posts that maybe it was the second highest in daily reports. Again, so we're at 14,000, 17 cases in New Mexico. There were 18 new cases in San Juan County yesterday. 8 additional deaths in New Mexico, so that number is now 527. One of those was in San Juan County. And again, some of the recent fatalities in San Juan County we've seen have been kind of younger, I think a man in his 40s is this particular case from yesterday. So again, folks are concerned about these these numbers and these deaths becoming maybe younger and younger, maybe without any existing health conditions. So that could be a concern. Recoveries were up again, another 148 on the recovery side for 6,048 recoveries. So that's where the state stands. As we mentioned, I believe the governor is going to be coming on this afternoon to give an update with her health officials about how things are looking. There's concern, of course, that if the numbers are still going up and up, that we may not move forward in the reopening phases, and it may actually go backwards.
Right, because initially she said it was going to be extended to July 15th, which would be next Wednesday.
Right.
So we'll see if it gets extended more.
Right. So we'll see what happens. If you scroll down, and again, we're at ksje.com/news. You can see some of the daily numbers there and the breakdowns. If you click on those stories, they kind of go through even county by county where things are and how things are looking. The bigger increases I'm seeing, too, I think we're now maybe third highest in the state. McKinley County seems to have a grip on some things. Their numbers seem to be kind of calming down. Doña Ana is where we're seeing a lot of growth in cases, which is in Las Cruces area. Navajo Nation, just briefly, 7,981. There were 40 new cases reported yesterday, 3 additional deaths on the Navajo Nation. So that's a total of 382. And we shared that story as well. And then from the hospital, they have updated their visitor policy. And again, as they're remarking there, 1 visitor allowed per day per admitted patient. And that includes clergy.
Gotcha.
So there you go. Calling you out.
Yeah, I know. Well, they're not calling us out.
No,
they're
not.
just saying, like, as they should, you don't have special privileges.
Right.
So
It's one-
climb off your high horse.
1 per day.
That's right.
So coordinate with
That's
the
right.
family and let us know what you want to
Coordinate
do.
with the family. That's right.
There you go. But anyway.
Yes.
So that's our numbers for today, everybody. Again, we appreciate you all watching and joining us each and every Monday and Thursday for this special program. We appreciate everyone sharing this on Facebook.
Yes.
And again, if there's questions that you have, we invite you to, again, write them down on our Facebook page. We can usually share them with our guests as they're calling in. And we appreciate that because I think that's why we're here, is to share this information.
right.
And if we don't think of the questions that you want to ask, by all means,
Ask
write
them.
them down.
Call in.
Yeah,
Even.
exactly.
Well, and also, if you have any suggestions on who you would like to see on the show,
right.
what kind of information are you still hunting for?
Exactly.
Yes.
Because we're hearing a lot and we're seeing a lot, and,
Yes.
and we're trying to find guests that are local with good, reputable information.
That's right.
These doctors are wonderful.
They
that
are.
we talk to. I mean, every
love it.
one of them.
That's right.
They've been great.
I feel like anytime we get injured or sick, we're good.
Yeah, you'll be
Well,
on a
at least-
first name basis with half
That's right.
the hospital.
That's right. Hey guys,
How's it
it's
going?
me.
That's right.
Yeah.
Exactly.
Yeah.
Just so anyway, so we appreciate you all joining us every Monday and Thursday and sharing the program. And we are going to be back on Monday.
Monday.
All right. There you go.
Tune in.
Have a safe weekend, everyone. Thank you for being here. Until Monday, this is Scott Micklin along with Megan Collop on KSJE. Have a good afternoon.